What I really want to cover today is what we've been doing in the interim here, and then really what we're working with the 3M Natural Resources Settlement on long term, how we're going to do that, and especially upcoming steps that will need input from the communities, and preview a little bit of that process since we'll have some key dates coming forward in December, January, and February. As Ginny mentioned, we first became aware of PFAS being present in the environment in the East Metropolitan area here in 2002. And over that time afterwards, MPCA directed 3M to continue to investigate where that was. One of the crucial items that I'll talk about is the 2007 consent order. It was a document that outlines what are the responsibilities of 3M at the disposal sites that Ginny mentioned, but also dealing with drinking water sources, whether it's private wells or city wells. And this document has funded a lot of work that we've seen, the sampling you've seen so far, and also the treatment systems have been put on private and public systems in the meantime. However, that's not the only damage that's been done as a result of the PFAS compounds. There are really a couple different programs under state and federal law that look at when areas are contaminated. And the first is the Superfund program, which looks at how are things caused, working to do the cleanup after they've done the investigation on determining the cause, and then treating direct impacts on human health or the environment, such as drinking water wells. And that's what the consent order and that whole set of regulations and requirements on 3M is based under. However, that's not the entire amount of damage that's been done in the East Metropolitan area. There are a lot of natural resources, foremost the underlying aquifers of this area, which serve as the drinking water for these communities, are also been greatly impacted. In addition, we have fish advisories and advice not to consume fish, for instance, in Lake Elmo, that have been impacted because of PFAS. So these are natural resources damages. So in 2010 and then settled in 2018, the state of Minnesota came to an agreement with 3M for what we refer to as the settlement. And that really looks at those natural resources damages. So I just want to highlight real quick the settlement. It was for $850 million to the states. A number of funds were used to start with, which brings for a number of costs, including legal costs, expert witnesses, the investigations that were needed, and the research done to prove the case. That left $720 million immediately available for our priorities. And you see there are two priorities. The first being the groundwater and drinking water supply, making sure that not only today but into the future there's safe and abundant drinking water for the communities. And the second priority is the restoration and enhancement of the natural resources. I talked a little bit about the fish populations, for instance, and the damage that has been done to the underlying aquifer, but also our surface waters. This also has a strong understanding that this will not be something that just the MPCA and DNR have a role in making the decisions, but set out the idea of the creation of a work group. And so while the settlement talks about creating one work group, we've actually created 3 different groups at this point. One is a citizen and business work group, which has residents and those who work within this area serve and advise the agencies as we move forward on this process. And a second is made up the local units of government themselves and 3M, and we call the government and 3M group. In addition to that, below that we have a subgroup which is very technical and are the folks that are from the communities that know the water systems and do that type of work, so that we have a number of people from the community providing information and feedback to the agencies as we go through this process. The settlement I mentioned had those 2 priorities. The first and highest one being drinking water, that there's safe and sustainable amounts of drinking water, not only now but into the future. And we've been working on that through the working groups, and that's been where we spent our time on that first priority up to date. We know that the money is there to achieve the goal is not infinite, and so we believe that not only through effective planning but efficient implementation we will be able to make this money go as far as we need and to be able to address things into the future. And how we really look to do that is that conceptual drinking water supply plan that was talked about earlier. This is a plan that will address all 14 communities within the East Metropolitan area that have been impacted on not only addressing how drinking water is dealt with today, but also into the future. And so as Ginny talked about, the private and municipal wells have had activities going on through that, and that's been covered under the 2007 consent order. So it's not a situation where we're planning and nothing is going on in the actual communities to ensure public drinking water and public health is protected. Those things are occurring at the same time. So we're addressing as we find areas where there may be wells over the health-based values, we're addressing them right away and while we do the long-term work. And so what is the Conceptual Drinking Water Plan? I mentioned that a little earlier. This is our plan for the 14 communities on how we want to address this long term. The key date here is where the goal is to have this done by March of next year. And this really is a 5-step process. And I just want to go over look quickly on those 5 steps. Here they are in aggregate. And break them down and just the things that we've done already. The good news is we've accomplished 3 of these 5 steps already, but to talk also about the next 2 steps and what that means for the communities and the feedback and participation we need from the residents and businesses and the local governments in the area. The first is we had to build a base of knowledge of this region, and that greatly came from information already produced by the local units of government, the watershed districts, and other work that MPCA, DNR, and Department of Health had already done in the area. I just want to highlight a couple things, and that's that bottom bullet point. We created a groundwater model for the entire region to be able to run future scenarios against, and also took all 14 communities' drinking water systems and put them together into one model so that we know if we do one thing at one end of the East Metro, how would that impact any other parts of the East Metropolitan area, which is going to be crucial as we look at planning for 14 communities and their drinking water systems long term. The next step we did is we identified a number of ideas and concepts of how would we address the drinking water supply long term. And so we looked not only at the municipal systems, but also private wells. And you can see the top 3 deal with private wells and how to address them moving into the future. And as we move down more, we look at those are on a municipal level. So these are ideas that we started with, and we got feedback from the work group on this effort. But we took those list of ideas then and then zoomed in on each community. So it's easy to say, well, we could put a treatment system on the city wells. Well, what does that look like for each of the communities? And that's what the conceptual level projects are. Looking at how many treatment systems are needed, what type of technology to use for these communities or working communities together. We did this 14 times for each of the 14 communities, not only looking at city drinking water, but also private drinking water. Some of these communities have both. And so there's a number of projects that we're looking at for each of the communities. And as you'll note there, the 3M Settlement website has a list of each of those conceptual projects. If you're interested, the website is 3msettlement.state.mn.us. And we have a drinking water tab that can bring you to this information. So this is the work that we've done at just a real high level. And the next is, I talked about having to do this for the entire region. It's now bringing all those conceptual level plans and building bundles of it for scenarios that address the entire region. So that's what we're in the process of doing right now, and then eventually apply that to our groundwater model and also our drinking water system model, so that we make sure that we don't have any unintended consequences. And as we look at systems, for instance, ideas may be interconnects to build backup systems for some communities between 2 communities. Well, how does that affect the drinking water system of both of them? Does that work? Many of the communities have different zones or different areas within their community with different pressures. Those things all need to be taken into account to make sure that the ideas that we propose actually can be put into effect later. And a very crucial part of this is determining the cost. And that's not only the cost of building these systems, but it's also the ongoing operation and maintenance of these systems into the future. And then eventually these systems may need to be changed out or upgraded, and to make sure to see if we can have dollars available to do that into the future too. Does there need to be a pot of money? If so, how much set aside in the future to address those issues? So those are technical data that we'll have, and we'll have produced in December to be able to share with folks. But there are a number of other questions that need to be answered to really differentiate between those different scenarios. And this is a task that we're working with both working groups right now, where we're creating criteria to apply to those different scenarios to see which ones are of higher value and interest. And the goal is then to have a good, better, and best scenario as a result, because there may be multiple ways to address the same problem. Some of those criteria look at very specific questions. So for instance, what is a cost-effective method? What is sustainable for the long-term amount of drinking water that's needed in the communities? How do we address future potential changes, whether it's changes in the standards as we learn more of research and if things need to be reacted to differently, or if we find changes in where we find the contaminant? How do we address that into the future? And so that will help differentiate which of the scenarios make better sense. That's why our good, better, and best as we move forward. In addition, we'll be having conversations with the local units of government and every resident, the residents in every one of those communities too. And that's why I want to hit on a few key dates. As I mentioned earlier, the more technical information is going to be available in December of this year, and we'll share that on our website, but also be able to push that out through our listservers and other types of media. And then looking for public comment in January and February. We'll be hosting additional community meetings to be able to get feedback so that we'll have some scenarios, cost estimates, and some of those criteria we talked about to get your feedback as we go back and start looking at what are the good, better, and best scenarios. These are things that we're going to need to have feedback for because some of them change the way potentially the systems work. For instance, on private wells in some areas, the option that we may be looking at is hooking up to city water. That's a change, or bringing water in from another community to serve private wells. That's something we're going to want feedback from not only the residents of the communities, but also the local units of government themselves too. And then so with that feedback, apply those criteria that we're working with the working groups on in March and have that good, better, best options. And then afterwards start with the communities and having those projects being implemented. Knowing that there will need to be time for design to be done and then construction, and that money or those activities would be covered by the 3M settlement money. Again, we just want to stress that our goals and number one priority with this work so far is the safe drinking water. We have systems in place to address the near term, the situation that is happening today on the ground, but the settlement is looking for that long term. We want to do this in a very organized way so when we look and don't rush into something and then 20 years from now say, you know, why did they make that decision? You know, if they spent a different time, maybe this other option would have became available, or more research would have opened up other ideas. And so that's why we're using a very deliberative process. But we also understand it's a balance between doing this additional work for a study and actual implementation and activities. It has to be a balance. We like to call it constructive impatience as we move forward on this. And then finally, again, our 3M settlement website not only has information on there, all the work group presentations are up there. This video will also be posted there, but there are fact sheets. And if you'd like to get information, we do have an email list that you could sign up for, which we send out information, including future public meetings or notices when things are posted to the website that may be of interest to you.